Hey, a quick note to chiropractors. And by the way, I love what you do. Chiropractors are truly better informed about nutrition than most doctors, by the way. Chiropractors are real healers. They help millions of people every day. But I just wanted to let you know, if you're a chiropractor, that your adjustment bed, or what do you call it, table, your adjustment table, it's full of other people's body lotion and fragrance, by the way, and it's really awful. So when I go see a chiropractor, I always bring a towel or put down a sheet of extra paper that they have there. I cover it so that I don't get other people's lotion and fragrance and perfume and all that laundry detergent crap all over me. And because I used to have to change shirts after I would visit a chiropractor. It's crazy. I'd get an adjustment, feeling good, and then I'd be like, dang, now I smell like lotion. It's from the table. Because so many people come into a chiropractor's office and then lay down on that table and they're just saturated with toxic lotion and crap. And by the way, if you are a chiropractor, you might want to tell people from time to time that it's a smart thing not to give yourself cancer, and don't coat your skin with cancer-causing chemicals in the form of perfumes and body lotion and toxic store-bought laundry detergent and all that crap. So that's my note to chiropractors. Now I have a note for massage therapists too. Yeah, we're going to make the rounds on some healing arts here today. Massage therapists, totally awesome art form, extremely healing. I think massage therapy should be covered by health insurance, by the way, because a massage therapist can help you more than a doctor in many cases. Sometimes you just need some stress reduction. So many people go in for back surgery, and what they really need is maybe some chiropractic adjustments and then some massage therapy to release some of the muscle tension. It can really help with circulation and moving lymph and all these things. Massage therapy is great. But I want to let massage therapists know, and this is nothing about my massage therapist. This is just something I've experienced in the past. Just in case my massage therapist is listening, he's like, what? No, this is not about you. This is about other people. Stop talking during the treatment. I'm not there to hear your download of all your week and everything that happened to you. I'm there to try to relax, seriously. And I'm paying you as a massage therapist, and I honor your work and your healing arts and your experience and education, but I am not there to have a conversation. And so just think about maybe a little bit of chit chat at first, just to settle in, and then pretty much focus on the massage part of the massage therapy. That's all I'm saying. So again, another great example of healing arts practitioners who are doing great work, but sometimes I had this one massage therapist a few years ago. She was, I guess, just really lonely or bored or something, and she was just always talking. I was like, hey, you know what? I don't have to pay people to have a conversation. So let's just focus on the therapy part here. And so that's just a little note to pass along there. All right, and now a note for doctors, regular doctors, who I haven't visited in many, many years, but I don't know, it was like over 15 years ago, I did visit a doctor, and these doctors are too busy to see a patient. And this one doctor, it was like I was having weird pain in my knee, which is long since gone. I think it was just tension. I wasn't doing stretching at the time. And anyway, I was having weird pain in my knee, and he just like feels my kneecap for 2 seconds. Says, "Oh, it's this. You overworked your muscle up here above the kneecap. Okay, that's it." I'm like, "What? That's it?" And he was totally wrong, by the way. He had the wrong area, and that wasn't the problem. He assumed I had like tennis knee or something, like I was over jogging or something. You know what? You doctors, you should spend more than 30 seconds with a patient. I mean, at least the massage therapist, they're spending the full hour with you, or hour and a half, even if they're talking sometimes. But at least they're dedicating the time to you. The average MD just is like 30 seconds. It's like, oh, I'm just going to read your chart. Just going to ask you a couple of questions. Like, do you have any guns at home? Because doctors are now gun control agents for the government. And then they just read your chart. They have blood pressure. And they just start prescribing pills or recommending surgery. But I got to say, I had this, I'm not going to give you his name, but this really awesome back surgery doctor that I had visited in Texas. And he's awesome. He's really, really cool guy. And because I had some back injuries, like pretty serious injuries from some of the martial arts training that I had done for many years. And had some back injury and some back pain for quite a while, which thankfully I don't have anymore for a number of reasons. But I was in a lot of pain at one point, and I visited him. This was many years ago, and he was so honest with me. He's like, "Yeah, we could go in and we could mess with your back, but you're a healthy guy. You're an active guy. This is gonna debilitate you. You're going to be in bed for 6 weeks healing from this procedure, and that's probably not a good idea." And I was like, "Well, what else can you do?" And he said, "Well, I can go and I can do injections. We can do like cortisol injections and things like that, but the pain's going to come back in a few weeks." I'm like, "That's no good. I'm not into that stuff. Just a bunch of monthly injections. That doesn't sound like natural health to me." He's like, "No, it's not." And he said I should focus on like strength and flexibility training. And it turns out that was exactly what worked. And for me, it was rolling, body rolling. Body rolling changed my life because it completely eliminated my back pain. There's a little bit of stretching, some body rolling, a little bit of Pilates, some strength training. But body rolling for me was the ticket. And since I discovered that, I have body rolled nearly every day. I don't even know how many years it's been now, but I body roll every day. I've missed maybe one day a year each year. I mean, literally only maybe one day a year that I've missed. So you talk about dedication. I'm dedicated to body rolling because it works. Which brings me to my conclusion. Sometimes, you go visit healing arts practitioners like chiropractors who are very good and massage therapists and so on. And they can be very helpful, but also ultimately a lot of this comes down to taking care of yourself, doing your stretches, doing your exercise, doing what you need to do to take care of yourself. Sometimes that's the best answer of all. I've seen many cases where people tend to externalize the healing and try to put it onto someone else and say, "Oh, you doctor, heal me," or "You herbalist, heal me," or "You homeopath, heal me," "Acupuncturist, heal me." And yet every practitioner in these arts, Chinese medicine, chiropractic care, you all know the same thing that I know, which is that 5% of the patients that you see don't take care of themselves, do they? You can tell them, you can make suggestions, clean up your diet, get the toxins out of your kitchen and your bathroom, stop coating your skin with cancer-causing chemicals, do a little exercise, get off the couch, for God's sake, people. And, obviously you would say it in a more nice way, but that's why I'm not a chiropractor, because I would just I would just tell people exactly what they need to hear, and I would have no clients. So it would not work very well. So all the chiropractors out there, you're safe. I will not be your competition. Don't worry. I would just tell people, stop poisoning yourself. Come back in 6 months when you stop poisoning yourself, and then we'll work on you. But the bottom line is that you got to take care of yourself. And it's great to augment that with, help from healers like chiropractors and massage therapists, Chinese medicine practitioners and herbalists and so on. That's great. Augment it, but don't externalize the responsibility for your health by putting it onto someone else and then expecting them to work miracles to overcome your personal laziness and lack of dedication to your own health. That's all I'm saying. Do both. Take care of your health and welcome others to help you do that. That's the solution that really works. Thanks for listening. Mike Adams here, the Health Ranger for NaturalNews.com.
Learn more at healthrangerreport.com.
Thank you for watching. If you want to support our mission, visit us at healthrangerstore.com for the world's largest selection of lab-verified superfood and nutritional products for healthy living. It's at healthrangerstore.com.